Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about breast cancer awareness, and joining me on the program are two persons from the Chronic Disease Unit. Dr. Danielle Dre Paul, the coordinator of the Chronic Disease Unit, and Dr. Martin Campbell, Technical Officer for Cancers. Welcome to the program, Dr. Dre Paul and Dr. Campbell.
Thank you for having us.
Now, Breast Cancer Awareness Month is one that we look forward to yearly. And the theme this year is Many Hands, Caring Hearts. Dr. Campbell, could you tell us a little bit about this theme?
Sure. So this year, like you rightly said, we're working with the team Many Hands, Caring Hearts. And that was a team that was developed through a collaborative effort. So this year we're working with GT&T again, and also all the breast cancer NGOs or cancer NGOs. So the team really came about because, literally when you look at it, it's many of us trying to make a difference when it comes to breast cancer. And we all care and want to share and lend a hand to, persons who are currently fighting the breast cancer and other cancers, and also, helping to support those persons who have already are considered survivors to reintegrate them into society. So it's basically, us coming together to share our time, our experiences, and to help those persons in need.
Definitely, and it is a collaborative effort. We know to fight breast cancer, it takes an entire nation to do so. We want to talk a little bit about the overview. We want to know what is the situation here in Guyana regarding breast cancer. Dr. Dre Paul?
Okay, so I just want to say that globally, in 2020, WHO stated that 2.3 million persons were diagnosed with breast cancer. Of this figure, 685,000 persons died. Within Guyana, our cancer registry registered last year 169 persons were diagnosed with breast cancer. And of these persons, majority of them were of Afro descent. And we also noted that the majority of cases came from Georgetown. But given that, we need to expand services to reach more persons, because we know it's a little bit difficult for persons from the hinterland and so to come to town. So we at the Ministry of Health, we're looking into procuring 3 more mammography machines so that we could station these machines strategically within the region. So it would ease the burden on patients having to travel to Georgetown.
Wonderful. What other strategies has the ministry adopted to combat the development of cancer and to spread awareness across the regions?
Okay, so right now we're working on a new guideline. We have been updating our guideline with assistance with Roche, and hopefully by the ending of this month, we will launch same. Also, we have been doing constant trainings with healthcare workers. So if it is that you detect that you have a lump in your breast, we actually advise patients to do a self-breast examination, not only for females, but males also. So if you detect that you have a lump in your breast, we advise you to visit your nearest health center, and here the doctor would examine you. And based on that, if it is that he feels that you need further evaluation, he will refer you to Georgetown Public Hospital, where it is we have a mammography machine to do the screening. And your results will be back very quickly.
Definitely. It's something that all women can look forward to.
Women and men.
Yes. And I know that the ministry usually promote early screening, which we will talk about a little later. But what I want you to mention now or talk a little bit about is the activities that you guys have ongoing for this month. We know that we usually look forward to this. So could you tell us what can we look for this month of breast cancer awareness?
Okay, so normally in the month of October, we have various activity planned. Just last Sunday, we had an activity which Dr. Martin was a part of. I'll let him
So,
take this.
so like we said, like I mentioned earlier, we're collaborating a lot with the NGOs and GTT to raise awareness and to pull off a lot of these activities. So last Sunday we had a tree wrapping exercise with the Gaping Hope Foundations. In fact, with all the the NGOs, but it was spearheaded by the Giving Hope Foundation, which is one of the NGOs. So it was Giving Hope, the Periwinkle Club, the Guyana Cancer Society, as well as GT&T, the Cancer Institute of Guyana, and of course Ministry collaborating to do a little bit of tree wrapping and raising awareness along the Camp Street area. This Sunday we will be having a symposium at the National Library, and that is basically geared towards persons who are diagnosed with cancer, persons who are survivors of cancer, to give them more information and help in terms of how to move forward. At the ministry here, we will be doing a little sort of tree wrapping exercise during the course of this week of the ministry's compound, as well as we'll be having one of our training sessions this week. So that is geared to be training healthcare providers from across the country in how to properly assess the breast and what next steps should be done depending on those findings. One of the main activities that we have planned at the end of the month is, I'm sure many of you would have known, is the collaboration with GT&T in terms of their Pinktober Walk. So that is scheduled for Sunday the 29th, starting at Everest and finishing off at Everest. So it's not just a walk, it's a health fair. So you can come out, you can get screened, you can find out information and whatever assistance you may need as it relates to cancer and other health conditions.
Thank you, Dr. Campbell.
Breast cancer is the most common cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breast, underarm and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
Welcome back to our program. Could we talk a little bit about what breast cancer is for those persons who are listening and viewing this program?
Okay, so breast cancer is basically the abnormal division of cells within the breast tissue. So it's a little bit complex because we have different sites that it could start from. So the layman may not understand. So basically, he or she just has to know that it's an abnormal division of cells. And when it is that you observe that you have, some patients may have different symptoms. Maybe they might notice that there's a discoloration of the breast, maybe the areola. They might see a dimpling. If it is that whilst bathing, they rub their hands around the breast tissue, they might detect a lump. So we advise males or females. Well, for females, if it is that you're menstruating 3 to 5 days after you commence your menstruation, that's the best time to check to see if you have any lump. But not all lumps that you detect are cancerous. It could be it's a benign situation, so don't be alarmed. If you detect this lump, just go to your nearest health center for a doctor to evaluate. Because I know this could be very stressful for patients. Also, we need to look at risk factors. Maybe if you had someone, your mom or your grandmother, someone in your family, that could be a major risk factor for you. But we have found in some research that some persons who don't have any family history of breast cancer, and they just notice that this lump appeared. So it's always better to be cautious and go and visit your doctor. Also, you need to look at things like your certain habits. If you drink a lot, if you smoke a lot, toxic habits can affect your health overall, not only for cancers, but it's not very good. You also need to look at when you first started menstruating, that's for females, and if it is that you have kids, because some persons later on in life, if they have kids or so, that may be a risk factor. If they breastfeed or not when they had their first kids, all those things can determine whether or not you develop breast cancer.
Are there different stages in breast cancer, and is it possible for someone to notice the symptoms in a late stage?
Yeah, well, and in the initial stages, you will not detect it. But as I told you, there are certain signs that you would see. So if you notice the discoloration, the dimpling in the breast or so, those are a little bit more advanced. The initial stages in situ, that you wouldn't see it. So most of the times we detect breast cancer when it's a little bit advanced.
Is there a particular age where breast cancer is more prevalent in developing, or it can develop at any stage of one's life?
So it can develop at any stage, especially if you had someone in your family who had breast cancer. We urge to screen early. That's why we updated our guidelines to reflect this. But from statistics, we have been seeing that patients over the age of 40, we're detecting more
cases.
Yeah, more cases.
And how long does the cancer take to develop once it is there?
Well, I cannot give you an exact time, and everybody's different. Yeah. It depends on your genetics, your environment, these things. I cannot give a definite time.
Okay, so we want to speak a little bit more about prevention. Could you talk a little bit about the importance of routine checks and annual screening?
Okay, so as I mentioned before, not only for breast cancer, we always urge patients to get an annual checkup. For females, you should have your gynecological checkup. Not only breasts, you should also have pap smear. You should have your general checkups like testing your blood sugar, because as we advance in age, things shows up. So we do advocate for that. You do not wait until you have a symptom, then you go to the doctor. We don't advocate for that.
For those of you who have just joined the program, today we're talking about breast cancer awareness. Stay with us, we'll be right back.
So, your doctor told you it's time to schedule a mammogram. You probably have some questions, like, will this take all day? Will I have to hold an uncomfortable position? Okay, want to know what to really expect your first time? First of all, wear a two-piece outfit so you only have to remove your top. And give your beauty products the day off. Think of the X-ray machine as your friend. You'll give it a quick hug as it compresses your breast between two flat paddles. The machine will use a safe, low-dose X-ray to take multiple images of each breast. The paddles might be a bit cold and you could be a little uncomfortable, but the good news is, the procedure only takes about 20 seconds per image. And that's it. Schedule your yearly mammogram around your birthday so it's easy to remember. After all, taking care of your health is the best gift you can give yourself.
Cervical cancer.
The second most frequently diagnosed cancer in women.
Here's what you should know.
This cancer begins in the cervix, the part of the womb that opens into the vagina. Cervical cancer is caused by the human papillomavirus, HPV. But women with the following risk factors are more likely to develop cancer. If you've had multiple sexual partners, a sexually transmitted infection, or an immune suppressive condition such as HIV. If your first sexual relation was at an early age, if your mother or sister had cervical cancer. Exposure to tobacco smoke also increases your risk. But cervical cancer is almost 100% preventable. Here's what you can do for prevention. Vaccinate your girls and boys with the HPV vaccine. Practice safe sex. Sexually active women aged 25 to 49 years should have visual inspection with acetic acid, VIA screening, every 3 years and continue screening with pap smears after menopause. Speak to your healthcare provider about your risk and where you can access free screening. A message from the Ministry of Health Chronic Disease Unit.
Did you know that 1 in 8 men will receive a prostate cancer diagnosis in their lifetime? While not always life-threatening, early detection is essential to treat prostate cancer successfully. You must visit a doctor to determine if you have prostate cancer, as it does not show symptoms in its early stages. Age, family history, and ethnicity can increase your risk of developing this type of cancer. Late-stage prostate cancer can cause difficulty urinating, weakened urine stream, blood in urine or semen, bone discomfort, weight loss, and erectile dysfunction. Talk to your doctor at the nearest health center to learn more about this disease and your risk factors. They can assess and suggest further screening if needed. Remember, early detection can make all the difference. Don't let this disease catch you off guard. Take control of your health today. A message from the Ministry of Health.
Dr. Martin, could you tell us what treatments are available for persons who've been diagnosed with breast cancer?
Sure. So in Guyana, at the public health facilities, we do have treatments available for breast cancer and cancers in general. So of course, we have chemotherapy at the Georgetown Public Hospital, the oncology unit. So that they have a wide array of drugs that are very useful, very good in terms of treating and curing cancers. But of course, that is most effective the earlier you diagnose that cancer. So that's why we encourage persons to get screened. We encourage persons to, go out there and find out about their health early, so that, if we do detect something, it's early on, and we can offer the best treatment that can, ensure that you survive that fight. Apart from the chemotherapy that's available, we do have a public-private partnership with the Cancer Institute of Guyana. They offer radiation services for breast cancer. And, we are trying to, of course, expand those services because as it is right now, most of that is centralized in Georgetown. So, of course, that is in the pipeline. That is part of the vision of the ministry to expand the services of treatment, diagnostics to other areas of the country so that persons, don't find it too hard to get to places and we can, reach a wider variety, a wider population.
Could you tell us how important it is for family support to be given, especially to persons who would have been diagnosed with breast cancer?
Family support and support in general is paramount. Being diagnosed with cancer, any type of cancer, is something that the individual, it's kind of detrimental. Regardless if you go through treatment, if you don't have that family support, if you don't have that community support, it feels like a burden upon you, right? It feels like a losing battle. So, the cancer patients out there, they really need support from family, from friends, co-workers, their community, and also other cancer patients and survivors, because none of us who are not diagnosed with cancer know what that feels like, right? So the survivors also have a very big role to play, coming out there to lend support and show them that there's actually life after cancer, and you can actually beat this fight.
Definitely. Before we wrap up today's program, do you guys have any final word of encouragement to our listening and viewing audience?
Okay, it's just to reiterate that we encourage everyone to get their annual checkup and to be supportive of a relative who may have been diagnosed with cancer. Because as Dr. Martin said, you really need this support.
Yes.
And to know that we have NGOs who have support groups who could assist you. And we have survivors who will tell this story so they know what you're going through. So you're not alone.
Yes, and I would like to encourage everyone out there to come out and support the ministry and the NGOs and all these activities that we have. I'm sure that we're going to have that shared on our social media pages so that you can come out and see what dates. Because the cancer patients and survivors, they need to see and feel like they're heard. Right, and we know that it's a struggle, and we want to lend support. So any way that you can support, if it's by showing up, if it's by donating, so that your efforts can go back to persons who need it, the cancer patients. Just come out, support, come out for the walk, come out for the health fair, and all the other activities.
Thank you so much for joining me in the program today, and I want to encourage you to keep up the good work that you guys have been doing at your unit.
Thanks for having us.
Thank you for joining me on the program today. I'm Alicia Martin, saying goodbye for now.